studios with our friends at Lake Health, and we're talking women's health and fitness with Dr. Alison Stalzer. Hi, how are you?
Hi, good morning.
Look at you, you're so nice and sweet.
I don't know about that.
I dove right into it with Alison. I couldn't help it because, once again, Lake Health bringing me things that are relevant to, if not me, somebody else in my life. And I have, you know, a couple of younger daughters that are getting close to being women. And the first question on our sheet, which is one that I actually wanted to know, what is the right age for a woman to start seeing their OBGYN?
So the right age is right around 13 to 15 years old, and that's for preventative screening, you know, kind of to start talking about sexually transmitted diseases, birth control, all those topics that are kind of sort of hard for parents to talk to their kids about sometimes too.
I don't want to. So you're telling me you can do that?
I can do that for you.
That's awesome.
But of course, if someone's having problems before that, you know, girls have their menses, you know, years before that, sometimes at 10 or 11. If they're having issues, they're always welcome to come see us before that time.
So I have a friend who was having a hard time conceiving, and she is the reason I found out that your weight can actually affect a lot of those other things. And I see on my sheets, like, why is exercise so important to women's health? I don't think we realize what an influence that has on other parts of our body, from something like trying to conceive to how heavy or light your monthly cycle is. I mean, everything. But if you had to tell people why exercise is so important, other than the obvious, what would you say?
So I think for me, it's always been you're reducing your risk of, you know, heart disease, diabetes, and really for women that are trying to get pregnant, weight is super important. One, because it not only puts you, when you're overweight, at risk for problems as far as, you know, preeclampsia and pregnancy and, you know, preterm birth, but, you know, obesity puts you at risk for gestational diabetes, and 50% of women that get gestational diabetes while they're pregnant will more than likely get like full-blown diabetes later on in life. Yeah, so it's actually okay to continue to exercise while you're pregnant. You just have to do some modifications. Now, of course, if you develop some type of, you know, complication, that will need to be modified. But you know, some women can do it the whole time and do just fine.
You can find Dr. Stalzer's offices at Tri-Point Physicians Pavilion. You can go over and mentor. And I'll tell you, like I said, Best of Health line, that'll get you the closest area, 1-800-454-9800. We want to welcome you to Lake County, by the way.
Thank you.